Good morning. You're listening to Caregiver Crossing, a podcast brought to you by Joy's House. We are so happy that you're here. Caregiver Crossing is a podcast created just for you, the caregiver. I am Tina McIntosh.
I'm Terry Stacy, and we're here every week, and we bring you experts from around the country, providing comfort and resources, and also joy to our caregivers. This podcast serves to really kind of it's a big hug for our family caregivers of today, and also for our caregivers of tomorrow. And I, too, thank you for being here. We're going to get right into it. Tina, you start.
Well, we have Shelley O'Connell with us today. Shelley is a dear friend of Caregiver Crossing. She is the director of the Post-Acute Clinical and Community-Based Services at Community Touchpoint. She oversees Touchpoint Senior Living and Post-Acute Case Management, Community Pro Care at Home, and Touchpoint Connections. So we're so happy she was able to make a few minutes to be with us.
Appreciate it. You should know Touchpoint really helps seniors access and navigate healthcare services while maximizing their quality of life through fun and fellowship with other seniors. It's important work and it's free. And Shelley, we're glad you're here. Tell us more about Touchpoint and the important work that you're doing.
Oh, good morning, guys. It's so good to hear your voice. So there's a lot of things happening here at Community Health Network for our seniors with our various programs. And you mentioned a number of the ones that I'm connected to, and there's also so many more. But as we look at, what's happening within our programs right now, we've got our socialization programs, which are on hold a little bit right now. We're planning for all kinds of fun for the new year at the moment because there's been so much changes that have been happening. And I think as we look at the other resources, we just have a ton of resources available to help geriatric and our senior patients and population and their family members at this time with so much within our clinics and our resources within the network.
Shelley, does somebody have to be affiliated with Community Hospital Network to be a part of Touchpoint?
No. So Touchpoint Connections is our free membership program that we have for seniors where we do classes, events, educational opportunities. Our annual large senior health fair, which we had to put on hold this year, but we're already planning it again for next year. But all of those events are free for seniors. We also have a nutritional program that we are offering in collaboration with SECOA and our network foundation. That's still going on as we speak. We've had to change and evolve the program a little bit, but we do have those resources available, and that's free for individuals to take advantage of as well.
During this pandemic, Shelley, what have you been able to do and what haven't you been able to do? We talked about some of the things that have been changed around and everything, but how did it really change what you were doing? Because we're still in a pandemic.
We are, and so much has changed. From a healthcare perspective, as things happened earlier in the year, a lot of things closed down, but we really took and evaluated a focus of how can we connect to our patients. How can we connect to those individuals who have been taking advantage of our classes and events and our socialization programs? And we've evolved that. And we've moved a lot of things to virtual platforms. So whether it's connecting to patients and others through phone or videos, we've put those in place, not only with our primary care and our specialists, but we've done that in other areas as well. And it's been really successful. We found that there's been some challenges for some individuals with the technology front. But we also have reached out to family members or encouraged those individuals to reach out to family members to see additional technology resources that may be available to them and had some really good successes with utilization of those as well.
So I think Community Pro Care at Home is one of the things that we mentioned in the introduction. I feel like that's not new to a lot of people. Is that true?
It is, and it's a great resource that's available now. So Community Pro Care at Home is our house call division. And so we launched that program it's been about a little over 2 years ago now, where we have nurse practitioners and a physician who can come to an individual's home to provide their primary medical care or kind of just stabilization related needs. So maybe someone had a recent hospital stay, has discharged home. We want to make sure that you're going to be successful in our home, and we can connect you to one of our nurse practitioners to come out, have a visit within your home, follow you for 30 days, 60 days, 90 days, whatever it may be, to make sure that you have the medications in place, you've got the resources in your home. We're also going to connect you to case management services. So is there other resources within our community that we can also connect you with? And then we're going to continue to follow you to make sure you're successful. And so that program, like I said, has been around for just about over 2 years now. We cover from anywhere from Kokomo and Anderson to Central Indiana with our team, and it really is a great resource.
This is Shelley O'Connell. She is with Community Health Network and involved in lots of Community Health Network. I mean, I know there's fancy titles and everything. You know, Shelley, she's been around with us for a long time here at Caregiver Crossing. And, you know, this is your moment. I'm giving you the stage. What do you want listeners to know right now about what you're doing, the work that you do as we move forward, and what you're excited about?
Yeah. So, I'm so excited that we've been able to evolve to meet the needs of both patients and family members for where they are now. Our network is working really hard with all of our resources and services to provide innovative ways to outreach, not only to our membership base of those who have been connected to the Touchpoint Connections program with our educational socialization events. We're planning more and more of those resources for next year to keep people connected and keep you involved. And we want to see your faces in the future when the time is relevant and things have moved forward within our community. And I know everyone's craving that as well, but we're able to do some of that virtually now. So it's always good to have the Zoom calls and to have these interactions where we can connect to people and see faces, because I think that's what everybody's looking for as well. But, you know, we're here to help and provide resources and services. And one of the events that we do have up and coming with open enrollment season is an open enrollment Medicare 101 session. We've had these in the past, and you can schedule time to meet with a pharmacist and talk through what your needs are so that you can pick the best plan for you. All that information is found on our website at ecommunity.com, and you can register right there, or you can call our network call center and get information about that program and that upcoming event. Those used to take place in person, and now, again, we've moved to a new platform and new technology focus to be able to make those connections. But those things are so very vital and very important as we move forward.
I'm going to tell you, sorry to interrupt you, Shelley, but I don't hate the virtual stuff for anybody.
Me either.
Like doctor's appointments or doing that. I mean, for crying out loud, Terry and I have been doing Caregiver Crossing in some form or another for about 10 years, and we could probably stand to go to the Medicare 101 class.
Yeah.
Great.
I mean, and I would much rather do it virtually than in person, but you can learn so much by doing these virtual. And I would encourage listeners, if you're interested in any way in learning and getting connected, then just do it. I mean, don't talk yourself out of it. Don't let those hesitations get in the way. Like, it's time. And you said ecommunity.com, Shelley, is the website. I cut you off, though. There was something else that you were going to say there.
Yeah, we're entering flu season, and I want to make sure that I mention that flu clinics are still available for patients. And so our network has really looked at creating drive-through flu clinics with our primary care practices, and those are starting here in the next couple of weeks. And so, it's so important for our seniors to get their flu shots, to help them stay healthy, especially with the environment that we're in right now, and having that opportunity to schedule an appointment for a drive-through with your primary care physician, drive up, have a specific time, get your flu shot, and be on your way is really a great resource that a lot of people can take advantage of.
I think a drive-through flu clinic is awesome.
Me too.
Yeah.
We're so smart now in what we're doing past this COVID stuff, because it takes us back to some basics. Like, I think as a society, why do we make everything so hard? But that's a whole different show. So tell us again how people can get in touch with you.
Yeah, so people can get in touch with us a couple different ways. Our main website, ecommunity.com, has a lot of information and resources on it. It has Find a Doc information. It'll have information about our classes and events. You can also call our call center, which is 1-800-777-7775, and that'll help connect you to those events and classes. And then, as always, if you're looking for a new provider or specialist connected to Community, our 317-621-2727 is our number to schedule an appointment with a provider and get you connected to someone who has open and availability. And we're still seeing patients in person. I don't want that to be not a takeaway, because a lot of people still want that and still want to see their provider in person. We're doing that within our healthy aging clinics, and we're doing it within our primary and specialty practices as well.
Okay. Shelley O'Connell, Director, Post-Acute Clinical and Community-Based Services at Community Touchpoint, 1-800-777-7775. If you'd like to know more information about the programs, and also ecommunity.com. Did I write that down right? .com.
That's correct.
Shelley, thank you. So good to talk to you and hear your voice.
Thank you. It's good seeing you guys and hearing you as well.
Tina, wrap it up.
I mean, that's it. We'll be back next week with a new show for you here, a new podcast. So join us. And until then, we ask that you take good care of each other.